Hello, my name is Saul Marcus and I am a naturopathic doctor. This is a presentation on natural treatments for Graves' disease. We are going to cover the following three objectives. First, how to control Graves' disease symptoms naturally with dietary changes and supplements. Then, what are potential triggers of Graves' disease and other autoimmune conditions? And finally, we're going to outline a holistic approach to treating those underlying triggers. I put in that asterisk on the bottom of the slide because controlling the symptoms and treating the cause of Graves' disease are not the same thing, and both of those have to be covered. This might be confusing right now, but it won't be confusing by the end of this presentation. Of course, Graves' disease is a very serious illness, and a thyroid storm is a potentially fatal symptom of Graves' disease. However, many presentations are much more mild and can be helped with natural medicine. Often, endocrinologists will recommend patients have their thyroid gland destroyed, either through radiation or surgery, and they'll recommend this right away. And in some cases, this does have to be done. However, destruction of the thyroid gland is not always necessary. Graves' disease does not always present the same way. Now, there is a textbook case of Graves' disease where someone is in risk of going into a thyroid storm. They may have very remarkable inflammation around the thyroid gland, ophthalmopathy, which is the protrusion of the eyes, and even pretibial myxedema, and that's seen in the photos to the bottom right of the screen. Now, yes, all of these are symptoms of Graves' disease. However, many people with Graves are not walking around with all these symptoms, and they're not in an immediate crisis where they need to have their thyroid gland taken out right now. And I do know that there are many more symptoms of Graves, and it would take many slides to go through all of them. I really don't want to cover all of that because this presentation is going to focus on natural treatments, and there's a lot more information on all the various symptoms online, so we can get that information easily elsewhere. But my main point is that there are many people with Graves who do not present in this sort of textbook manner. The textbook case is not necessarily the typical case, but rather it's something that doctors need to be aware of the most. And also, if you look online, it seems that the textbook case has this person with these protruding, eyes, and that does happen, but not everyone with Graves' disease is going to present in that manner. In fact, I see numerous people with Graves' disease, and you cannot look at them and tell that something is going on with the eyes at all, and not all of them even have any visual symptoms. The symptoms that I have seen more often is tremors, cardiovascular symptoms, increased appetite, weight loss, heat intolerance, and also elevated blood sugar on lab tests. So those are the type of symptoms that I've seen people have who are actually looking for a naturopathic doctor, someone to help them with. They obviously do not need to immediately have their thyroid gland taken out, but the medical doctors are recommending that. So what is the typical patient experience with Graves' disease? Well, in some people, the diagnosis may come only after a long period of looking for an answer. That's not the typical case. Graves' disease is something which should be diagnosed by most medical doctors, as TSH is a very commonly run lab. Yet this can be a misdiagnosis if the symptoms are not that severe. But once the diagnosis is made, the patient is told that there is no known cause for Graves' disease, which is a little bit misleading because we do know an awful lot about autoimmune disease, which just has not made its way into the conventional medical treatment. But also, patients are made to feel fearful and intimidated. They're given the options of either having their thyroid gland destroyed, or they are told to take toxic medications, which will basically just put off the inevitable of eventually having the thyroid gland destroyed. And I think that logic is part of the reason why medical doctors will typically recommend just having the thyroid gland destroyed. Considering all that, it should be no surprise that Graves' disease patients may describe their experience with conventional medicine as either depressing or hopeless. One of my big concerns with this is that patients need to feel self-empowered to take control over their own health. Only a self-empowered, proactive patient is going to take the steps necessary to recover from an autoimmune disease. And one of my jobs as a naturopathic doctor is to encourage my clients that there is a lot they can do to get better. In my opinion, this experience with medical doctors can lead to emotional paralysis and lack of action, as people might start thinking that if the doctor said nothing can be done, then what's the point of even trying to do anything? When in reality, there is a lot that can be done. The cause of Graves' disease is not entirely unknown. Of course, there is not a single cause of Graves' disease which can be reduced in that sort of fashion. Graves' disease, like other autoimmune conditions, is a multifactorial problem and requires individualized treatment plans. There's no single Graves' disease protocol for everyone. However, science does have a good idea of what leads to autoimmune disease, even if that knowledge has not made its way into conventional medicine. Toxic medications such as methimazole may not be needed, and destruction of the thyroid gland is not inevitable. Graves' disease is primarily not a thyroid disease. It is an immune system disorder that affects the thyroid gland. Therefore, any therapy for Graves' disease, whether it's surgery, drugs, nutrition, or herbs, that is only focused on the thyroid gland and not the immune system, will do nothing to treat the underlying causes of Graves' disease. With this in mind, I'm going to outline a two-step approach to treating Graves' disease patients. First, we want to control symptoms of Graves' disease using as many natural therapies as possible instead of toxic medications. This is because the supplements are not toxic. Ideally, medications can be eliminated altogether, but this of course does depend on the severity of the case. And once this is done, at the same time, we're going to start working on the underlying immune system disorder. So even though using supplements for Graves' disease symptoms will not do anything for the underlying immune system disorder, it's still important because, first of all, it takes time to work on the immune system, and Graves' disease is just too serious to leave untreated without controlling symptoms in the meantime. Eventually, you do want to get the symptoms of Graves' disease controlled by working on the immune system, and later on, eventually, then you can worry about taking away these initial supplements. Secondly, the medications for Graves' disease, such as methimazole, are very toxic, and the supplements generally are not, as long as they are used in a responsible way. So this first step is really about taking people off of toxic medications and replacing those with non-toxic supplements. So how does one go about lowering their dose of Graves' disease medications? Well, first of all, do not stop taking medications without talking to your prescribing doctor about it. You don't go out and get a bunch of supplements and say, okay, I'm starting these supplements today so I don't have to take the medications. Supplements are first added to the medication protocol. Then, if symptoms improve, the patient can go back to their prescribing doctor, and then that prescribing doctor can lower the dose of medications. So let's get to some supplements for Graves' disease. Carnitine is more commonly known for its ability to improve energy levels and to assist in burning fat and weight loss. But it also blunts the action of excessive T3 at the level of the cell receptor. So while this doesn't do anything to lower actual blood levels of thyroid hormone, it will make the thyroid hormone you have less active. What's really interesting is that in the case of normal thyroid hormone levels, carnitine is not suppressive. It only suppresses thyroid hormone action if there is too much thyroid hormone. And there are studies that show carnitine is helpful in Graves' disease in the doses of 2 and 4 grams per day. The picture on the right is of a liquid carnitine I used from one professional supplement company, just because the liquid form is more cost effective and carnitine is unfortunately one of the more expensive supplements. Herbs. Lycopus, otherwise known as bugleweed, its picture is up on the slide, is really the most well-known herb for Graves' disease, and it does work. Other herbs that can help control symptoms are Leonursis or motherwort for cardiovascular symptoms. Melissa is another herb which has traditionally been used for hyperthyroidism, and there are other herbs. I'm not going to just throw them all on the screen. These are some of the major ones. If using herbs, I'll typically use a compound formula such as the one on the screen, and often those will have some herbs that work on thyroid hormones such as lycopus with some other herbs like motherwort, which can help control cardiovascular symptoms if those are present. Selenium is a well-known trace mineral, and it's often used in detoxification programs, and it's also a powerful antioxidant. but there are studies that show it can help symptoms of Graves' disease. This slide has some quotes from two studies, one on blood levels of selenium, where they found that increased levels may improve outcome of Graves' disease. On the bottom half of the slide in blue is from an Italian study where and this was actually in the New England Journal of Medicine, and they found that selenium was helpful for the visual symptoms of Graves' disease. It was by no means a panacea, but it was helpful. And considering that selenium is cheap, readily available, and it isn't harmful in typical responsible doses, then there's no reason why it shouldn't be used. Other supplements can be used. One is lithium, and I haven't used this much, mostly because when you hear about it, the first thing people think is psychiatry, manic depression, and all sorts of neurological side effects. And I've just found that by going through the list of supplements that people can use, if I mention lithium, they get very scared and they want other things. However, the amount of lithium that will be taken in a nutritional dose cannot be compared to a pharmaceutical dose. In psychiatry, they'll start people out on 600 milligrams of lithium a day. A nutritional dose is going to be 5 milligrams or less, maybe even 1.5 milligrams, which I have given people. Now, 5 milligrams is less than 1% the dose of what's used in psychiatry. In psychiatry, they're using a pharmacological dose to really force an effect on the body. A nutritional dose of lithium is really just giving the body a trace mineral which it uses and needs anyway. It's not dangerous. It's not going to cause all sorts of neurological effects in these nutritional doses. Other supplements, vitamins A, D, and E. Well, these are fat-soluble vitamins, and they work together to lower inflammation and regulate the immune system. There are a lot of people who right now are mega dosing on vitamin D. I often say that it's been the fad supplement of the last 5 or 6 years. Well, vitamin D certainly is important, but it works with other fat-soluble vitamins, especially vitamins A and K. And what I'm worried about is in the future, we're going to see a lot of illness caused by relative deficiencies of vitamins A and K because people are taking so much vitamin D. And if you really want vitamin D to be effective, well, it works with these other fat-soluble vitamins. Vitamin A is very underappreciated. It has an effect on the immune system. It improves GI function. It's an anti-inflammatory, and it does work along with vitamin D. So I prefer to give these together. Now, not all the supplements that I mentioned are going to be needed in every case. Typically, I'll use the minimum support needed to keep Graves' disease symptoms in check, because the most important work is in balancing the immune system. However, of everything I mentioned, vitamins A and D are the ones I'll most likely have everyone on, because they will lower inflammation and they work on modulating the immune system as well. As far as diet is concerned, I'll try to get people with Graves or other autoimmune diseases on an allergy elimination diet. The really big offender that I absolutely want to see taken out is gluten. No gluten whatsoever. Also, artificial sweeteners. If you Google that online, that plus Graves' disease, that can be a big problem as well. In addition to this, there are some foods that are beneficial in hyperthyroidism, and these are going to be the goitrogenic foods that people with hypothyroidism are told to avoid. A goitrogen is simply a chemical that's going to make it more difficult for the thyroid gland to uptake iodine, so it's going to stop the thyroid from being able to make so much thyroid hormone. The best goitrogenic food is millet. That's a less commonly known grain, but it is a very powerful goitrogen. Other goitrogenic foods include broccoli, cauliflower, cabbage, kale, and turnips. Now we're going to get into talking about the immune system. This little schematic shows what happens. We have thyroid-stimulating immunoglobulin, also called, because some people like to be confusing and they like to give the same thing multiple names, it's also called TSH-stimulating antibody. But whatever you want to call it, this antibody goes to the thyroid gland and it stimulates it into making too much thyroid hormone. So the key point is that the thyroid gland is working, but it's the immune system where the problem lies. Question: what therapies does conventional medicine have to treat the underlying immune system disorder? And the answer is that conventional medicine does not have any therapies to treat the immune system disorder, they just totally ignore it. What is an autoimmune disease? Well, there are many very complicated and confusing explanations for this, but I hope that this slide kind of explains in a very simple way the basically what is happening. Well, it's an immune system confusion problem, where in certain ways the immune system is overreacting and it's making antibodies and attacking itself. So we have a lack of ability to tell self from non-self. But in other ways, the immune system is underfunctioning and it won't be taking care of invaders and other things that it is supposed to take care of. One explanation for a trigger of this immune system confusion is something called molecular mimicry, which is closely tied to gastrointestinal health. Within the digestive system, we actually have the surface area of about the size of a tennis court just within the small intestine. And across this entire surface area, the digestive system and the immune system is working to make sure that we don't have too many things come into the body that really shouldn't. And these things that we don't want coming into the body are going to be called antigens. And these could be foods that we're allergic to. These could be microbes, bacteria, fungus, anything the immune system needs to target and eliminate. That's going to be called an antigen. And we have what's called a mucus layer where some of these things are able to pass through so the immune system can target it. And that's what we see at the bottom schematic over there. We have at the bottom the green antigens that would be inside the digestive tract. Then we have a blue, that area representing the mucosal border, and then the red area with the smiley faces, those represent white blood cells, and that's the immune system seeing a limited number of antigens and attacking them for elimination. But now if we go to this slide, we see more what happens in this molecular mimicry, where we don't have a really tight mucosal border. So the antigens, instead of staying within the digestive tract, they go through and they actually enter the body. This is called leaky gut. And then the immune system is overwhelmed. We have all these antigens for it to take care of, and it starts making a lot of antibodies. And if it starts, some of those antibodies that it makes to take care of these invaders actually look like some of your own cells, the next thing you know, you can have an autoimmune disease. And this is a trigger for lots of autoimmune diseases. Now, I did go through the science in a very simplified way, but the key concepts that we have a compromised mucosal border and an immune system that is being overly triggered by, certain microbes or antigens in the digestive tract, that's a rather simple concept, and that's the important thing to understand. So the three factors that we need for this molecular mimicry is going to be, first, a genetic susceptibility. This is not a genetic disease. If you don't have these other factors, you're not going to get it. So genetic susceptibility does not mean genetic inevitability. Too many times things are blamed on genetics that just simply should not be. The other two things which are needed is going to be an immune system trigger. That can be gluten, which we're going to get into shortly. It can be some dysbiotic organisms, also we're going to go over those. And finally, a compromised border or some route of entry into the body. Because if you can't get something into the body for the immune system to react to it, then you're not going to get the autoimmune response. Okay, so let's look at some of these specific triggers. One potential trigger of Graves' disease seems to be a bacteria called Yersinia enterocolitica, which again can live in the GI system. Here we have a study showing 75% or 48 to 67 people with Graves' disease having antibodies against Yersinia, whereas less than 8% of the controls or people without Graves' disease had antibodies. So this connection between Yersinia and Graves' disease is all over the literature, and for Yersinia or any type of gut dysbiosis, well, that's something in which there are many natural therapies for. Another microbe which seems connected to Graves' disease is H. pylori, which is more commonly known for its association with gastric ulcers. There's a study from 1998 showing H. pylori connected to autoimmune thyroid diseases, including Hashimoto's and Graves'. But even though we have studies showing these these studies really don't make their way into standard medical practice in terms of treating these autoimmune diseases. All you get is recommendations to have the thyroid destroyed. However, there are, again, natural therapies to deal with H. pylori, Yersinia, or lots of other dysbiotic organisms. And if we have the information saying that looks like there's a link, and we have anecdotal evidence from practitioners seeing results resolving these with patients, well, that means that this is something we can go up after to remove the actual trigger of the autoimmune disease. And besides just using natural therapies to maybe kill these dysbiotic organisms, we can also use natural therapies for the leaky gut. Leaky gut, also called gut hyperpermeability, is a weakness in the digestive system's mucosal membrane, so things can get through that shouldn't. This exposes the immune system to too many antigens, as too many antigens are actually entering your body through the digestive tract, and this leads to the immune system confusion. This is common in many, many autoimmune diseases, whether it's Graves, psoriasis, rheumatoid arthritis, Hashimoto's, whatever the autoimmune disease is. If someone's coming into my office with one, this is going to be a consideration. And besides having a lot that we can do for this, there are many tests available. Functional lab companies like Diagnostic, Metametrics, Genova, Doctors Data, they all have tests that help see what's going on in terms of leaky gut and gut dysbiosis to find out what's going on. And in case leaky gut is an issue, there are, again, so many supplements for this. Those are a couple that I use in office and professional brands. But, common ingredients: L-glutamine, N-L-acetylglucosamine, MSM, lots and lots of herbs: DGL licorice, slippery elm, marshmallow, chamomile, cat's claw. And there's more, way more than I could just list on this page. What specific one I recommend, that goes on a case-by-case basis. But there is a lot that can be done for leaky gut, and it's a big step in many autoimmune diseases, but also any illness where sensitivities to foods, allergies, comes into play, because you really want to secure that GI mucosal border so you don't have things coming in triggering the immune system. And we have associations between Graves' disease and really all autoimmune thyroid disease and celiac. Celiac is a genetic disease where people have a sensitivity to gluten, which is in wheat, also in rye, barley, spelt, and oats. And this really triggers aberrant immune system responses. And in these situations, people cannot have gluten because it will have severe effects on not just the digestive system, which it has traditionally been associated with, but almost any other organ system in the body, including, the brain, the liver, but also autoimmune diseases. So we have studies showing that people with autoimmune thyroid disease have a greater chance of celiac. And yeah, these people should be tested. But how many times is someone with Graves' disease going to go into an endocrinologist's office and be told that, hey, maybe you have celiac and we have to test for it? Well, not very often. But in any of these cases, it's a top consideration. And I go over diet with every single person who comes in with Graves and any autoimmune thyroid disorder. Besides looking at just the GI system and leaky gut and some specific microbes, we also need to consider someone's entire history in relationship to toxicity. Is there a history of possible heavy metal exposure? What is going on in their work environment or home environment? Was there something like 9/11 exposure where in New York City, this is a big problem, where there are many people who were around the World Trade Center in 2001 and they got sick and they still are sick? What about dental work? Anything happened there recently where there still might be what's called subacute infections? Or any infection at all in that person's history? We want to look for things that can disrupt the immune system function. Also, history of antibiotics, as that can disrupt gut flora and overall immune system function. So if the case leads to more of an issue of toxicity and a need to detox, well, that's where the case goes. It's not a one-size-fits-all, problem with Graves' disease. With any of these autoimmune diseases, you have to look at the entire case, and whatever that person's body is trying to do, whatever health challenges they have, that's what you're going to look at, and that's what you want to work on with the goal of normalizing immune system function. There will be basic labs to look over. TSI, or the TSH receptor antibodies, should be monitored in Graves' disease. I have patients who told me their medical doctor didn't even know what this test was. So it can be something that has to be asked for. Also, often Graves' disease patients will be told to go through many invasive procedures in order to get diagnosed, when really diagnosis could start with a simple blood test. Also monitoring TSH, T3, and T4 levels. And additionally, we should look at inflammatory markers, because these autoimmune conditions are diseases of inflammation. ESR, or SED rate, CRP, or C-reactive protein. Those are other markers that can be monitored. In Graves' disease, we also have to realize that really high thyroid hormone can throw off many conventional labs. So if Graves' disease is pretty bad, then you can get your standard blood work done, and you're going to see markers all over the place. You're going to see high blood sugar and so forth. So while we do want to look at the labs, sometimes they're not going to be incredibly useful unless the Graves' disease symptoms, the Graves' disease is somewhat under control, because that high thyroid hormone is really going to throw a lot off on conventional labs. And of course, in addition to the conventional labs, there are specialty functional labs, which many people in natural health will do, and these will look at either GI function, but we also have many that look at toxicity, such as for the burden of heavy metals on the body, whether it's directly looking for heavy metals or something called a porphyrin test or organic acid testing. Well, those are some alternative tests I'm not going to get into here, but there are many tests which you're not going to get from a conventional medical doctor, but you will get from someone practicing more functional or holistic medicine, to look deeper at what's going on if we can't elicit what's happening from presentation and health history. Getting into more specifics of treatment plan, first thing is to dial down the inflammatory response, and that can include probiotics, vitamins D and A, which have big effects on how the immune system works. Other anti-inflammatory supplements, there are lots of herbs out there like turmeric, there's enzymes, there's many anti-inflammatories. Anti-allergenic diet, because we want to remove all allergens. Wheat, corn, soy, dairy, and eggs are the most common allergens in this country, and keeping blood sugar in check, because blood sugar is inflammatory. And then the other side of this is going to be detoxification. Typically, I would do this after bringing down immune system overactivity. Remember, with an autoimmune disease, something has come into the body which is triggering a response. So you really want to, in the long run, work with the body and help the immune system really get rid of this trigger. You want to do it in a safe way, so you're not really pushing the immune system, because if you just go and push the immune system with some herbs, then you could be, pushing the autoimmune response, which you don't want to do. But at some point, you want to get the body healthy enough to go through a detoxification. And this would be a safe, controlled detox. There are many rather harsh detox programs out there, like the Master Cleanse, and people doing like 14-day fast. We're not talking about anything like that. We're talking about gentle, safe detoxification protocols. Some additional therapies I'll go through with my clients, in addition to the standard supplements, are going to be homeopathics and isopathics. I'm going to talk a little bit about isopathics, because these are very powerful ways of modulating immune system response, and not many people in the United States are really familiar with this. Isopathics have been used in Europe for many decades, although it's very recently that practitioners in the United States have started to use them. And what an isopathic is, it's basically a very dilute amount of intracellular contents of either fungus or bacteria, such as Penicillium notatum or Penicillium roqueforti, which is actually the exact same fungus that they make blue cheese out of. So this is not live fungus. This is dead intracellular contents from the fungus. And what this does is it stimulates the immune system. So the immune system will see this harmless material, and then you triggers a response. And it's that response that we want. So the theory of how this works is similar to that of vaccination, but again, without injecting metals or harmful adjuvants into people. And one of the nice things about isopathics is that you can stimulate the immune system to start going after things you want it to go after. But in terms of this hyper reaction, we've seen autoimmune disease, it starts dialing down this too aggressive immune system response. So if someone has an autoimmune disease, you can use isopathics to calm down the immune system, to get the immune system to stop attacking one's own self. Yet at the same time, it will help regulate immune system function to really start going after the things that you want it to go after, whether that's these pathogenic bacteria or subclinical infections, whatever, all those things that we talked about, those are things that the immune system really needs to take care of. So this overall modulates immune system response. So there are different isopathics made from different fungus and bacteria, and though which specific one I use, that depends upon each client and their situation. And using these in conjunction with compound homeopathics really helps to tailor protocols for someone's specific situation and helps to normalize overall immune system function. So that's something that I use in combination with everything else, with all the herbs, all the nutritional supplements, the different functional tests if needed. And all those things can be worked together in order to normalize immune system function and hopefully get to the real root cause of autoimmune disease, rather than just telling someone, oh, well, you have to have your thyroid taken out. If you're looking for more specific information on maybe some other aspects of Graves' disease I didn't really get into, such as the conventional treatments, dangers and side effects of medications or radiation therapy, there's a lot of information in the book by Elaine Moore and Lisa Moore, Graves' Disease, A Practical Guide, where they really took a lot of the information, the standard medical text, and they put it in more simple terms. But this is not a dumbed down book by any stretch of the imagination. This is really the go-to place for more information on Graves if you start reading all the different books. So I could not recommend this one enough. I'd like to thank anyone who stuck around and watched this entire presentation. I know it might seem like a lot of information. However, this is really just more of the most essentials that I can shove into a little bit more than a half-hour video. If you have any questions, you can send an email to me. If you're looking for answers for Graves' disease and you don't want to have surgery or radiation therapy, then I would really most highly recommend looking for a natural health care practitioner around you who can help, who feels comfortable dealing with autoimmune disease, whether that person is a naturopathic doctor or a chiropractor or a holistic MD, an acupuncturist, whatever the degree may be. That's not so much important as just, willingness to actually work through this and having a grasp on autoimmune disease. And, I have a practice in New York if anyone wants to check me out. But if not, then I hope this video was informative, as I'm just basically trying to get this information out. Okay, thank you. Goodbye.